we will proceed with the project under the EU for Health. And in particular, we'll start discussing the CRANE joint actions. So a few words regarding the project. So CRANE aims to, as we said before, carry out preparatory activities on the creation of national comprehensive cancer centers and EU networks. So it is a 2-year project with a 3 million contribution from the EU. But we will learn now more about the project from the representatives. In particular, I'm very great to have here today with us Professor Tit Albrecht, that is head of the Center for Health at the National Institute of Public Health in Slovenia, that is the coordinator of the project. And Professor Albrecht is also assistant professor at Faculty of Medicine, University of Ljubljana, and also Dr. Anastasia Balazolopoulou, that is a director of the Public Health Division of the First Health Region of Greece, that is a competent authority that is involved from Greece in the project. And now I will give the floor to Professor Albrecht.
Thank you very much for this kind presentation. I will introduce the project only to the extent, I mean, the presentation is longer than needed for this meeting, only to the extent it hadn't been mentioned by the colleagues from other projects already. So where does the concept of the network of comprehensive cancer centers come from? It comes from the Europe's Beating Cancer Plan. So far today, we have been listening about the mission on cancer that triggered and launched a number of initiatives. And now we are coming to the Europe's Beating Cancer Plan, which is the plan under the EU for Health program, under the auspices of the DG Santé. So EU Network of Comprehensive Cancer Centers is one of the flagships, one of the key activities of the EBCP, which focuses on improving quality of life for cancer patients and survivors. So there are 5 aspects. You have already heard about those aspects. Maybe they are not as broad as the ones mentioned by the CCI for EU. We are focusing mostly on the activities that are, as a standard, provided and delivered by CCCs, starting from early detection and screening through diagnosis and treatment, and then activities that in some places are still lagging behind, support to cancer survivors, and research and training of the cancer workforce. Of course, there is a meeting point between the cancer mission and the EBCP, and that is the 10th recommendation of the cancer mission, which talks about the comprehensive cancer infrastructures that we have just heard from the previous presentation. Of course, there are some important differences between the two concepts, and I hope that you will understand some of them, mainly focusing on the fact that CCCs are narrower in their, and that you first have to have CCCs and then you can have CCIs. So the network of CCCs is the first initiative, I would say, of the European Commission, the European Union on healthcare organization. I was personally involved in the preparation of the first presidency of Slovenia to the Council of the European Union when cancer was the main topic. And once in a discussion, in a policy dialogue, we mentioned impact of the European Commission on delivery of care. And one of the big countries said, excuse me, healthcare delivery is the competency of the member states, and you are not going to discuss this here. So we were basically walled off that discussion. So we have come a long way. Of course, many years have passed in the meantime. So there is an interest to also support member states in finding organizational solutions that can help them deliver better and a higher quality care. Of course, streamlining efforts to equalize access to optimal care and improve its delivery are important issues. So all the 3 projects that you will hear about, 2 of them you have already heard about in today's session, and then also Jane will be presented. all these 4 projects actually are interlinked and have their respective positions. There are some general and some specific objectives. I would point out only the fact that, of course, the establishment of the network is the main objective. And, of course, there is also the objective to explore the setting up of high-quality care through comprehensive cancer care networks. So also another type of delivery of care. This is the structure of the project, the 4 standard work packages. Many of work packages are supported by 2 leading institutions, and our Greek colleagues are supporting the dissemination work package, and the green work packages that have to deal with the governance of the network and of the framework and standards are respectively led by the Italian Alliance Against Cancer, which is an association of comprehensive cancer centers in Italy, and jointly by the Oslo University Hospital and the French National Cancer Institute. The blue ones are led by the German Cancer Society and the Catalan Institute of Oncology. Sustainability work package has a special role in the fact that it should provide the so-called maturity model that would serve to the comprehensive centers as their self-assessment tool, and also support the development of comprehensive cancer centers as a concept through the foreseeable future. A few details, like you've heard from other projects. It's a shorter project, only 24 months. The total budget is 3.7 million euros with 80% co-financing by HIDEA. It will finish very soon, in 3 months' time exactly. So we are finalizing the deliverables. Of course, there were some challenges we faced. The establishment of the network by 2025, this is still hopefully reachable through the next project. Ensure access, this phrase is some phrase that has raised a lot of discussions with us and with CCI4EU and other colleagues. What does that mean, 90% of the eligible patients? Some people say it's 90% of all cancer patients, which is not feasible. Some people say that it is only 90% of the patients that belong to the treatment in comprehensive cancer centers, and probably the truth is somewhere in between. Of course, we have to take into account that the Commission took a clear organizational preference. Some people asked me, but what about other organizational formats and so on? In this project, we discuss CCCs. We cannot say, well, actually, there are alternative 3 types to the organization. No, this is actually supported by the policy document. So it's very difficult to say now we're going to fragment this into or atomize this. Of course, there are some particular challenges for small member states. The 3 smallest ones, 2 are even islands, Malta and Cyprus, and also Luxembourg, which is more conveniently positioned among 3 big neighbors. They have, of course, important challenges. I mentioned the network concept, and of course, this interlink between care, research, development, training, and innovation. There are some points that are still under discussion. What is a comprehensive cancer center, comprehensive cancer infrastructure? I think this is going to be resolved very soon, also through joint work and discussions. Centralization versus decentralization. I have already mentioned this morning for a country with geographical challenges like Greece, a total centralization would be damaging. It would hurt a lot of the population in access. But on the other hand, you cannot have a cancer center everywhere that you have 30,000 people. You have to have the peak, the top institutions concentrated, but then, of course, you provide not only networking through formal physical networking of institutions, but also through collaborations between, among experts. There is another term that is used in EBCP that is a little bit deceiving. EBCP speaks of the creation of the network of national CCCs. What is a national CCC? One CCC, is it a designation that, like in the US or in the UK, this is a national, not a regional institution? So we opt for the fact that it is closer to the second word, because most big countries would not be happy by accepting that there is only one national CCC. In regionalized countries, they have other challenges, maybe about those more in the discussion. So we will connect CCCs that exist. They will be welcome to join through a facilitated, easy procedure, and then new centers will enter as they meet the required level of standards. I will skip some of the discussions. Of course, the presentation will be available for all to see and discuss. So the new project, Hadea actually now pushed us a little bit. So the new project will start immediately after the end of the current project, which is a big challenge for us as the coordinators and also for all the key partners, because they are all also key partners on the new project. So there will be some overlap, but we also have to distinguish between the activities. What are some of the key points that I would like to stress and reiterate again in these conclusions? There is a move to a comprehensive improvement of quality in cancer care through reducing its inequalities. There has to be the triangulation among cancer care, research, and training of competent workforce. I think in the previous session, we heard a lot about Agios Savas and their efforts to reach the requirements. Also, the story of MDTs. Again, I was reviewing a cancer plan of one of the member states, smaller ones, and we realized that they don't even call MDTs on a regular basis. So they have them every 3 to 4 months. And some of us were quite shocked to hear that. So for many environments, there are many challenges involved. And of course, this will be an opportunity to also extend the collaborations beyond the borders of the countries. We have experience with that with European reference networks, and maybe we can now make another step towards that in that direction. I also included some information on the new project, but I will not spend too much time on that. And I will just say Evcharisto, and thank you for this part of the session.